it's okay to put out the shunt and do your third ventriculostomy. If you have a CSF infection with a protein more than 300, so do not do endoscopic third ventriculostomy. If you have a protein less than 300, go for third ventriculostomy.
For time consuming, I'm asking about how many ventriculostomy can you proceed in morning?
You need a counter. Actually, you are talking about the learning curve. The starting endoscopic third ventriculostomy, when I first started in 1995, I was doing the procedure in 1 hour, 30 minutes. We are doing a straightforward endoscopic third ventriculostomy now in 16 to 17 minutes. So there is a learning curve in endoscopic procedures. Maybe at the start you will, let's take the average and you will do it in 1 hour. So if you have 4 hours operating time in the morning, you can do 4 ATVs. No. When you diagnose infection, you have to take a sample of CSF to see the color. The color. Okay, it's not obvious, so the proteins will not be that high. So you go for third ventriculostomy. Try third ventriculostomy.
When you found there is a not clean CSF by your inspection, you see
The non-clear CSF is an obstacle doing this surgery. Is an obstacle doing this surgery, but you have to wait and wash for 5 or 10 minutes to get rid of this debris and put a clean media you can operate through.
I'm just going to take the chance that I'm chairing this session to ask 3 questions probably. Because nobody's raising his hand now. My first question, now putting in consideration that is we might counter such problems like iliac acid membrane, what's the pre-operative investigation that you do for such patients? Do you just resolve to CT scan or do you need to do always MRI before doing the procedure? The next question, how often do you see problems like subdural hematoma after doing the procedure? And thirdly, we know that is with ventriculostomy, that is the best is the obstructive type of hydrocephalus. And especially say if somebody is having a tumor, the fourth ventricle, and there must be 2 choices. I can take that patient to the theater and do ventricular tapping just before proceeding with the resection of the tumor. So when do you choose to do ventriculostomy for such patients? What type of patient do you choose actually? Thank you.
About the first question, actually we do MRI in every patient with hydrocephalus to avoid many things, the anomalies and the pre-poncitine cistern assessment and the foramen of Monroe assessment. And this is a routine study in performing endoscopic third ventriculostomy. And about the second question, the subdural hematomas. The subdural hematomas is collecting if you have injury of a cortical vessel and is still leaking inside this space. But if you have a clean field and you coagulate the cortex well and the pria well before introducing your ventriculoscope, this will make no subdural hematomas. Yeah. Actually, no sudden release. You have a controlled release of CSF. You have a controlled release because you're using an obturator which is fenestrated. You can control the CSF going out of the ventricle, not suddenly decompress the ventricle. Yes, yes, yes.
Is there any role for ultrasonography to diagnose the thickness of the mucous membrane intraoperatively?
Actually, the introduction of ultrasound probe is quite new in neuroendoscopy. The probes is still bulky and not that efficient to resize or sizing the thickness of the liquid membrane. Because the size of the probe and the frequency they use in the ultrasound is still manufacturing.
If it's there, can you use it?
The ultrasound,
Yes.
if it's there, I'm using. I'm going to use it.
Yeah. Is it helpful?
To assess the liquid membrane or to no, I don't think it's of benefit to assess the liquid membrane. I think even the MRI is deceiving. You may go with a MRI with no obstruction, and you go inside there, and you found the liquid membrane obstructing the floor. Yeah, this is an intraoperative finding. Yeah.
Okay, thank you again, Dr. Darrag, and thank you for your contribution and discussions. Well, I just came to know that the next presentation is going to be incorporated in the practical session. So we'll be having more time to do the practical session, at the same time we'll be discussing about the instrumentation. Just before we move to the other room, probably Dr. Darrag is going to give some announcement.
الرحمن الرحيم. بالخصوص البراكتيكال تم التقسيم ل5 مجموعات. هتبدا المجموعات من 1 ل4، كل مجموعه فيها 6 زملاء، والمجموعه الخامسه بتبدا بعد ما يقل العدد شويه. العشاء هيكون الساعه 8 9:30 في صاله الاسكل على شارع النيل. وبكره العمليات الساعه 8 صباحا في مستشفى الشعب، هيكون الناس في قاعه السيمينارات وحتى الساعه 11:30. والليكشرز بكره هتكون في نفس المركز هنا. العمليات هي هتكون قاعه السيمينارات في مستشفى الشعب لغايه الساعه 11:30 تقريبا او 12. والمحاضرات بتبدا هنا من 12 لغايه 3، وبعدك حيكون في الختام وتوزيع الشهادات. شكرا. العمليات حتكون في السيمينارات، قاعة السيمينارات حيكون في بروجيكشن، يعني العدد حيكون في السيتر حيكون عدد محدود يعني. ان شاء الله ان شاء الله. ايوه ايوه.
So you are invited now to move to the other room. Yes, those who want to attend.
المجموعة الخامسة اللي هي حتنتظر شوية هي
distinguished people. So I think that is a great success for this course as a start, and we shall continue in these courses in collaboration with these people and Carl stores and other companies. It's time for to finish this course. a small closing ceremony. Where is Dr. Izzeddin will come to have some Quran phrases.
أعوذ بالله من الشيطان الرجيم. إن في خلق السماوات والأرض واختلاف الليل والنهار لآيات لأولي الألباب الذين يذكرون الله قياما وقعودا وعلى جنوبهم ويتفكرون في خلق السماوات والأرض ربنا ما خلقت هذا باطلا سبحانك فقنا عذاب النار ربنا إنك من تدخل النار فقد أخزيته وما للظالمين من أنصار ربنا إننا سمعنا مناديا ينادي للإيمان أن آمنوا بربكم فآمنا ربنا فاغفر لنا ذنوبنا وكفر عنا سيئاتنا وتوفنا مع الأبرار صدق الله العظيم.
أقدم بروفيسور علي عبد الرحمن دري أستاذ رئيس المخ والأعصاب بجامعة الخرطوم في كلمة closing remarks speech.
بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وبعد. السلام عليكم ورحمة الله تعالى وبركاته. I was asked to give closing remarks about this workshop. First I said, why should Dr. Darrag use me to do this? And I came to know I'm the oldest. I'm the oldest one who is in this room. So thank you very much, Darrag. Now, this workshop opens a lot of doors and windows for the neurosapiens, especially those who are in training. Now, there are some reasons that this workshop did very well and well organized, and it is of great help to all of us. So I think the first reason is that the presence of Dr. Darrag is really working and helping us in doing such workshops. Thank you very much, Dr. Darrag. وجزاك الله خير يعني. The second important reason is the presence of Professor Darrag, who gave us from Pakistan, who gave us a very good remarks, very good interpretation to the clear videos which have been given, and you are welcome, Dr. Darrag, to Sudan, and I hope you are going to stay a few days more than what is being decided before. The other thing is that we are having Dr. Darrag. No one could ignore the great role given by Dr. Darrag. He organized this workshop, and he was being in contact with all the contributors who are going to give this. So thank you very much, Dr. Darrag, for this nice work with us. Now, I think we had 2 days, although they are long, but I think they were very useful to all of us, and I think we are happy, we are glad to see all our young registrars and the senior postdoctors being here. So, and that is why I'm going to thank Professor Darrag of Lahore for his acceptance to receive senior registrars in his hospital, and that I think is going to be very good for us and for our colleagues who are here. Now, the company have been doing a lot of work during this workshop. That is the car stores company. Now, without this help, we would not be in realistic situation now. So we had really a very good and excellent and marvelous workshop, and I think we have to repeat this workshop again and again until we are going to master everything. And I hope that Dr. Arbab will be, and Dr. Bakhil Hadi could accept to take the duty of having a set of endoscopy in the country. That is extremely very important. And if we are going to train ourselves, then we have to have a set which is really. And I'm asking Al Hadi and Arbab to look into how this can be a realistic situation. Now, I have nothing more to say than thank you very much for your coming. وجزاكم الله خير. السلام عليكم.
نقدم دكتور بروفيسور طارق لطفي، مشرف الكورس واستاذ جراحه المخ والاعصاب جامعه عين شمس في القاهره. كلمه قصيره.
بسم الله الرحمن الرحيم. الحقيقه ما كنتش عارف ان انا هقدم اي كلمه دلوقتي خالص، بس الحقيقه انا سعيد جدا بوجودي معاكم، وانا الحاجه اللي جذبتني جدا في وجودي معاكم ان هو حبكم للعلم وتقديركم للعلم، وده حاجه الحقيقه ما بقتش موجوده في عالمنا دلوقتي، وانا شايف ان دي خطوه، قصدي ميزه موجوده وتؤدي بيكم ان شاء الله الى فتوحات كثيره باذن الله. واتمنى من الله سبحانه وتعالى انه تكون مقدمه الاندوسكوبي اللي عملناها ما تكونش مخله في قصرها وتكون مفيده، ويكون بعض الريماركس اللي اتقالت كلها عالقه في اذهانكم لتكون بدايه ان شاء الله. اهم حاجه ان انتوا تحصلوا على السادس، لان انتوا لو ما ابتديتوش فورا هنبتدي تاني من اول وجديد بعد شهور قليله. الحصول على السادس معناتها ان احنا نبتدي على طول ان شاء الله اللي احنا قلناه في الورك شوب، والكونتينيوتي بعد كده. انا مش هيبقى عندي ابدا اي مانع في ان انا ارد على تساؤلاتكم عن طريق الايميل او عن طريق التليفونات او باي وسيله كانت، والحقيقه هيبقى في منتهى السعاده لو لو طلبت ان انا اجي تاني، او ان انا اقدر اشوف اعمل ورك شوب تاني او حاجه زي كده. اتصالنا طبعا من قديم الازل ومرور النيل ما بيننا، والواحد بيحس فعلا ان هو في بلده بحقيقي، مش مجرد كلام ومش مجرد ان انا موجود في المكان ده. انا في منتهى السعاده وفي منتهى التقدير لكل المجهودات من جميع الناس الحقيقه، وعلى راسهم طبعا اساتذتنا الافاضل دكتور ابو بكر الدراج، قام الحقيقه بمجهود مش قليل، وانا شايف ان هو الفضل الله سبحانه وتعالى في النجاح والمجهود اللي عمله الدكتور ابو بكر في المؤتمر ده. اساتذتنا الافاضل من كل الاماكن، من كل الاقسام، من كل الجامعات، الحقيقه انا شفت حفاوه وشفت كرم استقبال في البلد ما شفتوش في مكان تاني. انا سعيد جدا المره الثالثه بوجودي معاكم. اتمنى ان احنا نفضل دايما في تواصل، اتمنى ان احنا ان شاء الله اللي احنا قلناه يبقى يثمر ان شاء الله عن شفاء بعض المرضى باذن الله سبحانه وتعالى. متشكر ليكم جدا، والسلام عليكم ورحمه الله.
لا يفوتنا ان نتقدم بجزيل الشكر للبروفيسور محمد احمد عبد الرحيم من المملكه العربيه السعوديه، وبروفيسور محمد جلال النجار من سوريا الشقيقه لمشاركتهم السره والقيمه في هذه في ورشه العمل هذه. ولهم
Bismillah ar-Rahman ar-Rahim, alhamdulillah, wassalatu wassalamu ala Rasulillah. Always there are surprises. Again, I was not prepared to say anything other than to thank people for what they have been doing over the last 2 days. And if there's any one thing to say, the message, I hope our young colleagues, they have posed that message. That is, we are waiting really to see them doing what they have learned, to adopt what have they learned, and to shoulder the responsibility of neurosurgery in Sudan for the future. It is you that you can really make the real change. And it is you that you can really make the future of Sudan as regards neurosurgery. So we are looking forward really to have you there and to see you, and then we'll be very happy that you have really learned from this workshop. Professor Darrag from Pakistan, we are very grateful for your being here among us. And again, I must say, I don't know Professor Darrag before. This is his first visit to Sudan. And right from the very beginning, he is welcoming to have our registrars there for probably periods of short training. And that is really something that we must close, and really we look at it that is really sort of forward, that is something, a collaborative attitude, that is really that how we can be together and how we can bring up this discipline together. Thank you very much, and we are looking forward really to make it a reality, that is to have this collaboration. And equally, from our side, we say it is welcome for the Pakistani residents to come here to see what is available in terms of pathologies and practice here in Sudan. So we are very welcoming this collaboration. Thank you very much for your contribution in this workshop. Thank you, Dr. Darrag. And surely I just want to remind you, whoever drinks from the Nile water will be back again. Be
يتقدم الآن الدكتور الهادي بخيت استشاري جراحة المخ والأعصاب ورئيس المجلس الاستشاري لجراحة المخ والأعصاب ونائب رئيس لجنة التخصص في المجلس القومي السوداني للتخصصات الطبية لتقديم بعض الهدايا لبعض الضيوف. يتقدم. الدكتور طارق لطفي. دكتور فيصل الفايز من شركة كارل ستورز. دكتور إبراهيم العلمي من كارل ستورز. حان الآن وقت تقديم الشهادات، ونبدأ ب بروفيسور محمد أحمد عبد الرحيم من المملكة العربية السعودية. بروفيسور طارق صلاح الدين من باكستان. بروفيسور محمد جلال الدين النجار سوريا. بروفيسور طارق لطفي. الدكتور إبراهيم العلمي. مرواكو، مندوب شركة مرواكو. مدير شركة بتاع الصوت في السودان. شركة دبوك. دكتور فيصل عبد الله الفايز، وحاسبهم لسه شوية. شركة كارلو ستورز. وإلى مستشفى الشعب التعليمي. مستشفى الشعب التعليمي قام بالدور الأكبر في دعم هذه ورشة العمل هذه. شهادات تقديرية للبروفيسور حسين سليمان أبو صالح، بروفيسور علي عبد الرحمن بري، بروفيسور محمد عبد الرحمن أرباب، دكتور الهادي بخيت، دكتور كمال صالح، دكتور عبد الحميد عبد الله، بروفيسور ابراهيم محجوب، دكتور زكريا ابراهيم، دكتور بشير محمد بشير، دكتور محمد سعد احمد، دكتور معاوية عبد الله حسين مهدي، دكتور عادل الامين عبد الرحمن، دكتور علي عوض علي، دكتور عبد الرحمن عباس، دكتور احمد عبد الهادي، دكتورة سحر ابراهيم، دكتور محمد علي منصور، دكتور محمد حسين زياد، دكتور علي بابيك السيد احمد، دكتور محمد عبد الباسط، دكتور عز الدين محمد علي، دكتور محمد سيد مطري. دكتور ربيع محمد أحمد الأمين. دكتورة هبة الحاج بابكر. دكتور أحمد عبد الفتاح خالد. دكتور محمد عبد القادر موسى. دكتور هيثم حسين محمد. دكتور سامح أحمد حسن. دكتور أحمد سعد حسن. دكتور جميل مروان. دكتور صلاح الدين عوض عبد الحليم. دكتور غالب عوض التميمي. دكتورة ندى اسماعيل الصديق. دكتور خالد الصديق عبد الله. دكتور الفاضل عثمان العوض. وختاما دكتور خالد الحاج. دكتور درج. Draw your attention as there is a group picture to be taken outside, okay?
you.